Hello, I'm Ashley. I'm going to be your nurse today. Could I have your name and date of birth, please? I would confirm their name and date of birth on the ID bin. Today I'm going to be doing your abdominal dressing change. Are you having any pain at all today? If they had pain, I would medicate them and come back in 30 minutes to reassess. I'm going to place the patient in the proper working height, which is about waist level for me. I'm just going to go wash my hands, gather my supplies, and I'll be right back. When washing my hands, I'm going to ensure to keep an eye on the patient because they are at a higher height. When washing my hands, I'm going to ensure to wash in between my fingers, the tips of my fingers, and the backs of my hands for at least 15 to 20 seconds, keeping my fingers pointed downward. And drying off my hands completely. Okay. I'm going to don clean gloves. Okay, I'm just going to now expose your abdomen where the wound is. Okay, when removing the dressing, I'm going to gently pull down on the skin while removing the tape. When I remove the dressing, I'm going to assess the dressing for the color, amount, type, and smell of drainage. Also, when removing the 4x4 pads, I am going to assess the color, amount, type, smell, and drainage. When removing the bandages inside the wound, I'm going to look at the color, amount, type, smell, and drainage. I'm going to look to see how many were in the wound, and I'm also going to make sure not to touch the edges of the wound. When looking in the wound bed, I am looking to see if there's granulated tissue, which would indicate healing. I'm looking to see if there's any eschar, and I'm going to palpate around the wound to feel for bogginess. If there is bogginess, it would indicate tunneling around the wound. I'm now going to measure the wound. I'm going to measure in centimeters because that is what was previously documented in, ensuring not to touch the wound. It is 14 centimeters long, 2.5 centimeters wide, and to measure the depth, I will use a sterile cotton tip, sticking it in the deepest part of the wound, trying not to touch the edges, and bringing my fingers down to be level with the skin. And I will also measure this in centimeters. And it is 2 centimeters deep. Okay, I'm now going to remove this pad. Again, top to bottom, clean to dirty. Remove my gloves. Perform hand hygiene. And then I will go down the center of the needle. And now open up my sterile package. Opening up my sterile package, I'm going to make sure to open it away from me. I'm going to insert the Foley into the remove. Again, making sure to have everything sterile. I'm going to keep going until I see a urinary return. And then I'm going to laying out my sterile field. Once I lay out my sterile field, I'm going to remove the contents of my package. Make sure to keeping a 1-inch border. And now I'm going to put some sodium chloride, sterile water inside my tray. If the sterile water was open, I would make sure to check the date that it was within 24 hours, and I would lip the bottle first. Putting that back. And now I'm going to don my sterile gloves, making sure to keep an eye on my sterile field. below the end of the bed. Okay, now that I have my gloves on, I am able to touch my hands. Now that I have my gloves on, I am able to touch the sterile contents within my package. Making sure to reposition the patient. I'm going to fluff up the 4x4 pads. Place them in my sterile water. Make sure they are comfortable. Putting the bed all the way down for patients. And now I'm going to clean the wound bed. I'm cleaning the wound bed with swab sticks. When cleaning the wound bed, I'm going to clean from top to bottom, clean to dirty, slowly rotating the swab sticks on first the outside. Then I'm going to clean again from top to bottom, clean to dirty, on the other side, slowly rotating. And now I'm going to clean the middle, top to bottom, clean to dirty, slowly rotating.
Hi, my name is Taylor. I'm going to be the nurse today. The doctor would like to remove your Foley catheter.
Now I'm going to get my forceps,
I would correctly identify the patient using
the soaked 4x4 pad.
Mrs. Powers. I'm going to position you that way.
Now that I touched the 4x4 pad with this hand, it is now clean and wet. I'm going to place it inside the wound, ensuring not to touch the outside of the wound.
I would make sure that there is no
going to grab the other one.
drainage bag prior to removing the catheter. If there were, I would empty the bag first.
Again, ensuring not to touch the outside of the wound.
I'm going to remove my gloves and gather my supplies.
Okay. Remove my forceps, and with my sterile hand, I'm going to gather my 4x4 pads.
Put on a new pair of clean gloves.
Place it on top of the wound. And then gathering my ABD pad, placing it on top of the wound. Now I'm able to grab my tape
Place a waterproof pad underneath the patient.
and tape around the edges of the ABD pad.
I'm going to place two just because I don't like mess. I'm going to make sure that the bag is now above patient level, so it's not working area. I'm going to remove the catheter from the patient.
Now that the bandage is back on, I am going to put a name, date, and the time that it was changed on so that the next person changing it knows. I am going to remove my dirty supplies.
I'm going to gently slide out the catheter.
Place the patient back into the lowest position. Remove my sterile gloves. Perform hand hygiene.